Okay, I think we're ready to go. Okay, good evening again, everybody. Welcome to another one of the Oz Hair monthly seminars. This evening we'll be presenting a short case study, a little bit different to some of the seminars we've run in the past couple of years. So this will be a little bit shorter, but the topic is called "From Pharmaceutical to Herbal Hair Loss Treatment." So, as I mentioned, it will be a case study, and we'll just go through and see how one of our clients who came to us was originally using some pharmaceutical hair regrowth products, and eventually came to us and used our services. So we'll just do a quick go through what we'll discuss this evening. As I mentioned, it will be a real case, and we'll see why he changed from pharmaceutical products to our herbal hair regrowth program. Then we'll have a quick look at, we'll quickly do a comparison of some of the different treatments available out there, and then we'll finish with some other things to consider before starting a hair regrowth treatment. So what we'll do firstly is we'll watch a short video of this gentleman, and we'll let him explain in his own words what his experience was before sort of coming to us.
My name is Kishore. I started my treatment here in May, but I would like to share something with you before I started this treatment. I started with the pharmaceutical treatment before doing this treatment. I saw this ad on TV about regain foam, and I thought it's something better, like, just easy to apply and use. So I got the treatment. I went to the pharmacy and bought that foam, and I said, start using it. I started using it, and within 6-7 days, I found that the skin of my fingers was peeling off. So I thought to myself, if that's happening to me on my fingers, so what would be the state of my scalp? So I said nothing to me. I said, I don't want this. I went back to them. I said, see, this is what is happening. I don't want this product. I returned it back. And then once when I was just crossing this road, I saw this board here in Australia, hair and scalp clinic. So I said, might as well just come here and see what treatment I can get. So when I came and met Louis, he said, let's have your scalp analysis done. So he saw my scalp thing and he said, okay, let's start with the 2-month treatment. So I started with the 2 months treatment, and before I could start the treatment, I can see the baldness patch. It was quite huge. And within about a few weeks, I could see a lot of improvement. And 2 months time, you can see the difference. The patch is almost filling up. So after that, I said it's really good. It's really helping me, and now I'm going to start with the 8 months treatment. So that's about it.
Okay, yeah. So that was Kishore's experience in his own words there. We'll just quickly go through that case in a little bit more detail, because sometimes when people speak, we might miss some of the details. So I'll go through that. So yeah, obviously this was a male in his age in his early 50s, and he was actually experiencing a condition called androgenetic alopecia, which is basically male pattern hair loss, or the genetic type of male hair thinning. And before he came to us, as he mentioned, he did try tried a pharmaceutical treatment, which was Rogaine or minoxidil. The actual the drug, that the active ingredient in Rogaine is minoxidil. And I think he used that for about a week before he started having some problems. So what were those problems again? Well, within about 6 or 7 days, as he mentioned, he noticed that the skin began peeling off his fingers, sort of after he was applying, or after he was using the product, he was obviously massaging it into his scalp. Obviously being concerned about the effect of the product on his fingers, he then became worried about, if it was doing that to his fingers, what would be the effect on his scalp. So within a short period of time, he stopped using this treatment and began our herbal hair regrowth treatment instead. And after about 2 or 3 months, we can already seeing some results here. Apologies if the photo is not that clear. We usually sort of use the red circle there to highlight the improvement. And keep in mind, in the second photo, we've actually parted the hair to try and show a little bit more of it. I'll show you the side views, probably a little bit clearer. That one there's a lot clearer. You can actually see the very, very thin area there on the crown. And, in the after photo, about 3 months later, that area is filled up considerably, which is a good result in that relatively short period of time. And keep in mind, at this point, he probably hasn't regrown a great deal of hair. Usually in 2 to 3 months, people don't regrow a lot of hair. Most of it is the existing hair improving in condition, and therefore it sort of stands a bit more erect on the scalp, and it makes those thin areas appear to thicken up. But that's still a good result, and people are obviously very happy with, even if the existing hair improves, if it can thicken up those thinning areas, then it's obviously still a good result. Let's have a look at his crown area. This is the major area where we can clearly see a difference, and this was his major concern anyway. It was the back sort of part of the scalp, the crown area, and as you can see there, lots of thinning area, very, 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 very thin hair in this region. And, about 3 months later, look at that. There are still some thin areas there, just sort of on the bottom of towards the bottom of the highlighted circle there, but certainly a lot better than it was, 3 months before. Definitely thicken the area up. It certainly doesn't look as bald as it did, in the first photo, in the before photo. So obviously he was very happy with that result. So let's look at some of the current hair loss treatments that are on the market. And Kishore did mention that he started with pharmaceutical treatments, and so we will mention those, but keep in mind that there's also herbal and nutritional options out there which can be of assistance with hair regrowth. So we'll start with the pharmaceutical option that Kishore took, and he was basically on a drug called minoxidil. So it's in a foam. It's the product's called Rogaine. Minoxidil is that's the active ingredient, and that's the one where you actually just apply to the scalp. So it's an externally applied foam, and its major mechanism is that it's a vasodilator, so it opens up blood vessels in the scalp and brings more blood to the hair follicles. So naturally, in blood, there's a lot of nutrients and oxygen, so that can contribute to the hair regrowth effect. And some other alternatives out there are obviously the Chinese herbal treatment that we use here at Ozhair. There are Western herbal medicines that are also being shown to be effective, such as saw palmetto, quite sort of highly regarded in Western herbal medicine for hair regrowth. And don't forget nutritional supplements that are also useful. So things like vitamins and minerals, and minerals such as zinc, very good for the hair. Vitamin B5 as well, and other nutritional such as omega-3 fatty acids that are also viable treatments as well. I'd like to just make a point here, quite an interesting one, that although Kishore did start with a pharmaceutical treatment, I think it's important for people to understand that pharmaceutical medicine has not yet created a drug that's specific for hair loss. The medications that are on the market now for hair loss are basically they were basically medications that were created or designed to treat other medical conditions. In the case of minoxidil, which is the one that Keyshaw used, that was originally used for high blood pressure or hypertension. So the issue with this is that side effects become more common, because if you're treating medical conditions, usually those drugs are quite powerful, quite strong. So they're it's not uncommon for them to actually have side effects, and that's the problem with when you're using that for hair regrowth. So Keyshaw mentioned the problem with his fingers, the skin peeling off. These are some other side effects that you can get with minoxidil use: blurred vision, chest pain, dizziness, problems with heart rate, facial swelling, and even weight gain. So definitely worth to be aware of those. In terms of effectiveness, the particular medication that Keyshaw started with, the minoxidil, their own company have published a figure of approximately 60% effectiveness for people that used minoxidil after 1 year, which is might not seem a bad result. With the treatment that we use here with our herbal treatment, we're getting 99% success rate. Okay, so that's a combination of people that over a 3-month period didn't actually lose any more hair, so that's quite a good result. Actually, not losing more hair in over a few months, and obviously a much higher percentage than that actually regrew hair. So the herbal treatment that we use is actually very effective and considerably more effective than minoxidil. We'll look at just have a quick look now at the method that we use in our herbal treatment, called herbal follicular activation. And what it basically is it is usually a combination of home use and in-clinic treatments that firstly stop any excessive hair loss, if there's hair loss at that time of beginning treatment. It'll also clean and unblock scalp pores. Okay, we want the scalp pores to be clean and open so that it can absorb the active ingredients in our herbal medications. The treatments also activate and nourish hair follicles, and also reduce hair follicle sensitivity to DHT. DHT is basically a hormone that causes hair loss. So that's basically what we do, and this is the treatment that Keyshaw decided to go on, and as you saw in the photos, had a very good result with. I'd like to just finish with a couple of other important things that you may want to consider before choosing a treatment. With our herbal treatment, and I imagine with others as well, there's no major side effects associated with their use. Our herbal tonics in particular haven't had any major side effects reported in 20 years, as it says here. We are 100% herbal solution, and a combination of liquid tonics supplied to the scalp and herbal tablets taken internally. Another important consideration is that for people to be aware that there is actually no permanent cure for male and female pattern hair loss. So that's the genetic type of hair thinning. There is no permanent cure, so long-term treatment is necessary, and even maintenance treatment further down the track. So once you find a treatment that helps you, you need to stay on it for life, not necessarily at the same high dosage, but in some form. You still need to apply or use or take products that have helped you regrow your hair, because as we mentioned, there's no cure for it. So eventually the genetic component will kick in, and you will go back to your original state if you don't maintain it with whatever product helps you. So that's all I've got. That's all I've got for you all this evening. this was quite an interesting case study about people that have used pharmaceuticals and found a better herbal alternative. So definitely something to keep in mind before embarking on your own hair regrowth treatment. And we'll have a break for about a minute or so before we introduce before our nutritionist, our nutritional consultant, comes on and presents some information about this month's topic. So we'll just have a short break, and then we'll bring our nutritionist in to give you some good nutritional information.
Okay, good evening, ladies and gentlemen. As Nick just mentioned, we're now ready to go on with our nutritional component of the talk this evening. And as you can see up on the screen tonight, we're going to talk about probiotics. Now, it kind of seems that everywhere you turn at the moment, you're hearing about probiotics and how good they are for you. But a lot of people don't really know exactly what they are, what they do, where they can be found in the diet, etc. So I thought what we'd do tonight is spend a bit of time going over that. So I guess a bit of a summary, as I just said, we will just really quickly talk about what they are. We'll do a little bit of a history about where they've come from and how they were discovered. And then, yeah, we'll talk about some of the diseases that are associated with having low levels of this beneficial bacteria in your body. Then we'll look at some food sources as well. There's a lot of ads on TV as well at the moment which talk about good and bad bacteria, and that can be equally as confusing for people who don't know what it's all about. So hopefully by the end of the talk you should be a bit more aware of what it is that's going on. So let's get straight into it now, and we will look at what are probiotics. So simply put, probiotics are live, naturally occurring microorganisms, usually bacteria, that function internally to promote healthy digestion and beneficial bacteria. They boost the immune system and they promote good health. So just a really brief history. So we've got at the start of the 20th century, now it was Eli Mechnikov, who was a Russian Nobel Prize winner and also known as the father of modern immunology. And he was the first to kind of conceptualize probiotics. Now, a little bit before him, it was actually Louis Pasteur that I guess really got the ball rolling, but it was Eli Mechnikov who really stepped it up. In 1907, Mechnikov proposed that the acid-producing bacteria in fermented milk products could prevent fouling or going off in the small intestine if it was consumed regularly, and it would also lead to a longer, healthier life. Now, what he noticed was that Bulgarians who drank milk fermented by lactic acid-producing bacteria all led longer lives. Then in the 1930s, in Japan, it was Minoru Shirota who developed a fermented milk product called Yakult, and I'm sure most of you have already heard about that. Now, Yakult is a probiotic yogurt a probiotic-like product, which is made by fermenting a mixture of skimmed milk with a special strain of Lactobacillus casei shirota. So it's just a fermented milk drink, which has been shown to have these beneficial effects. So Yakult was really the first big thing to get probiotics out there. Now, if we're looking at the human body and exactly what's going on in terms of your bacteria, before you're born, your intestines are virtually sterile, so they're free from any microorganisms at all. And then once you pass through the birth canal, you're swallowing flora on your way out. And from that point on, you've got both good and bad bacteria populating your intestines. Now, I guess this is where the argument of a natural birth versus a caesarean birth comes into it, and why a lot of natural professionals say that unless there's a medical reason for you to have a caesarean, a natural birth should be the way to go. Basically because when the baby does have a natural birth, then they are getting inoculated with all those beneficial bacteria from the mother, which they are actually missing out on if they're being born via a C-section. Similarly, the argument of breast milk versus formula. Once again, a similar situation where there are special nutrients and probiotics in the breast milk the baby's getting directly from the mother, which are not actually present in the formula. So I'm not going to go into that today. It's a bit of a heated discussion, and that's not what I'm here to talk about. But I just wanted to briefly touch on if you are pregnant, or down the track, are you thinking about breastfeeding versus formula feeding, etc. Just something to keep in mind. So when the body's healthy, the harmful bacteria never get a chance to overtake the good bacteria and to reproduce and cause illness. The problem is that every day we're exposed to billions of potentially harmful microorganisms through things like food and water. Now, when you are healthy, there's over 100 trillion microorganisms from about 400 different species that flourish in the intestinal tract. And these aid in digestion and absorption. They aid in the production of B vitamins, vitamin K, and enzymes. And they cover every square inch of surface space, basically from the mouth all the way down to the anus, which crowds out the harmful bacteria and it leaves them nowhere to gain control. So if you kind of think about it, where there's no space for bad bacteria to populate, if it's all being populated by the good bacteria, then the bad bacteria just don't have a chance. So some of the reasons for beneficial bacteria to decline. So we've got friendly bacteria can lose their vitality as they age. Unfortunately, it's just a part of the process. Any disruptions to the acid or alkaline balance in the bowels is going to reduce your beneficial bacteria. Non-steroidal anti-inflammatory drugs are going to have an impact on your good bacteria. Chlorine in drinking water. Now, not only does it sterilize water so that it's safe to drink, but it also destroys all the colonies of good bacteria in the intestines. Radiation and chemotherapy, obviously they just kind of go in there and destroy everything. So that is going to wipe out your stores of good bacteria. Now, any non-organic meat, chicken and dairy is going to be loaded with antibiotics, and antibiotics destroy beneficial bacteria once again. Similarly, any diet that is high in meat and fat, these products take a long time to break down in the body. So the longer they are in your body, the more the promotion of bad bacteria is going to be encouraged. Anyone who's constipated or experiences constipation regularly, similar to what I just said, if you've got the waste products in your body and it's actually not passing through as quickly as it should, then it's just going to be sitting there in your gut and fermenting. And through that fermentation process, you're going to have an overgrowth of your bad bacteria, which is going to cause a string of problems. Cigarettes, alcohol, and stress all deplete your beneficial bacteria. And finally, antibiotics. So as I mentioned not too long ago, antibiotics go in there and destroy both good and bad bacteria. And that's just going to encourage your overgrowth of bad bacteria again. Now, there are a number of diseases that are associated with low levels of beneficial bacteria. This isn't an exhaustive list, just a couple that I've come up with. So PMS, some types of cancers, yeast infections, bad breath and body odor, acne, allergies, constipation and diarrhea, ADHD, urinary tract infections, colitis, and headaches. So probiotic food sources, what are some of those that we can include in our diet? So I've just got a quick diagram here. So first up, we've got sauerkraut, which is a fermented cabbage. It's easy to buy in a health food shop, just as easy, and also as fun to make yourself at home. Miso, tempeh, yogurt with active cultures. Now, really important when you're buying yogurt from the store, the packaging actually needs to say that it does have active cultures or live cultures in it. If it doesn't actually say that on the packaging, then you're not getting the benefit of a probiotic by having that yogurt. A lot of the time, the manufacturers put the probiotics in there before the yogurt's actually heated, and that heating process actually kills them off. So they really just put it in there to say that, so that they can say it has probiotic cultures in it. But unless they were added after it, you're not going to be getting the effect. So make sure it does have those active cultures. Kefir is next, which is a fermented milk drink. It can be made with milk or it can be made with water. Kimchi, which is popular in some Asian cultures as a bit of an accompaniment to your meal. And kombucha, which is a fermented tea. Very easy to make, or you can get the components of that from someone who has their own tea already fermenting, and get some batches brewing at home. Now, these are foods that should be included in your diet every single day. So you don't have to include all of them, but at least try and have one or two of them in there. And so next we're going to talk about prebiotics. So just to get things a little bit more confusing, we already know that probiotics can help improve and maintain the health of your gastrointestinal tract. But it's the prebiotics that help the good bacteria to survive. So these stimulate the growth and the survival of the good bacteria while discouraging the growth of harmful ones. Now, one of the really important things to remember between probiotics and prebiotics is that probiotics can be digested. So they're not always going to make their way down to the small intestine, but prebiotics are non-digestible. So they are going to get down to the small intestine when they're needed and going to be able to help you out there. So similarly, here's some prebiotic foods. You've got chicory root, Jerusalem artichoke, dandelion greens, garlic, leek, banana wheat, asparagus, and just a prebiotic supplement if you're not including any of those foods daily. But, you know, I always push for food above a supplement. So if you can include some of them in your diet every day, you're really going to notice the benefits of that. I've just got a quick diagram here, which is just looking at good and bad bacterial flora. So some of the good ones, we've got bifidobacteria, we've got E. coli, and we've got lactobacilli. And then the bad, you've got Campylobacter, you've got Enterococcus facialis, and you've got Clostridium difficile. So if you just have a look under there, it just kind of says some of the benefits in the good, and when looking at the bad, tells you some of the things that they might actually cause. So kind of just to summarize the information that we've gone over today, firstly, include prebiotic and probiotic foods daily to ensure that you're maintaining the healthy bacteria balance in your intestines. A course of antibiotics will wipe out the good and the bad bacteria, so it's always important to follow it up with a course of probiotics once the antibiotics are finished. One of the problems here is that people don't have these probiotic foods in their diet. So you have a course of antibiotics, your good and bad bacteria are completely wiped out, and then your lifestyle habits and your dietary choices, which are not so healthy, I suppose, are going to promote that growth of the bad bacteria again. And if you don't have those good bacteria going in there, it's going to be completely out of balance and the bad bacteria are going to flourish. All the different species of probiotics can get very, very confusing. So if you're not sure which one is right for you, just speak to your healthcare provider for some advice. There are specific strains of probiotic that are indicated for different health conditions, etc. Some of them are specifically for something like maybe traveler's diarrhea, irritable bowel syndrome. Some of them are just to promote general health. So while some of the similar strains will be present, there's different combinations of different strains in different products. So speak to a professional. They can give you some more detailed advice that is right for you. The names do get very confusing, but just one of the things to remember as well is that there are some key names. Generally, the name that's on the end of the probiotic is just the name of the person who actually discovered it. So if you remember back to the very beginning when I was talking about Yakult, and it is Minoru Shirota, who came up with Yakult, and the special strain in that is Lactobacillus casei Shirota. So he's just popped his name on the end of it so that everyone knows it was him that discovered it. And finally, and I guess very important, when you're first starting on a course of probiotics, it can cause some side effects. So less is definitely more in the beginning. You are really making some changes in your stomach, and you can experience things like bloating, flatulence, you can get some diarrhea, etc. So it's really important that you start small and build up your tolerance to it instead of kind of going in there full pelt and yeah, really upsetting the balance and probably putting yourself off ever having probiotics again. So that's all we have today. I hope that it has been enlightening for you and you're a bit clearer on what exactly probiotics are. I guess the take-home message is that, yeah, you should be including them daily in your diet just to help promote that, that delicate balance in your gut. And I think it's a pretty exciting time in terms of probiotics and just gut health in general, where a lot of the advances in medicine at the moment are discovering that, I guess, the gut is the start of all diseases. So if you can kind of keep that healthy, you're doing yourself a massive favour and hopefully avoiding any serious illnesses and diseases later on down the track. So thank you for tuning in, and I'll be back next time with another topic for you. Thanks very much.